Efficacy of mindfulness-based relapse prevention in veterans with substance use disorders. Design and methodology of a randomized clinical trial. This was printed in Science Direct, Contemporary Clinical Trials, Volume 105, June 2021, 106393. Authors were Kathleen Brady, Therese Killing, Nathaniel Baker. Abstract. Mindfulness-based interventions have been shown to be efficacious in treating depression, anxiety, pain, and substance use disorders. Mindfulness-based relapse prevention, MBRP, is an intervention that integrates cognitive behavioral relapse prevention and mindfulness meditation practices in an 8-week manualized group intervention designed to treat SUDs by helping patients regulate negative emotional states and reactive behavior. This paper describes the rationale, study design, and methodology of a 2-site randomized controlled trial comparing MBRP to 12-step facilitation, TSF, in military veterans following completion of intensive outpatient treatment for SUDs. The 8 weeks of 90-minute group-based MBRP or TSF sessions are followed by a 3, 6, and 10-month follow-up period with assessments of alcohol, drug use, quality of life, depression, anxiety, mindfulness, and other functional outcomes, such as employment. The primary hypothesis is that MBRP will be significantly better than TSF in promoting recovery and prevention of relapse to substance use in a military veteran population. The second hypothesis is that MBRP will lead to greater improvements of quality of life, depression, anxiety, and functional outcomes such as employment. This study is designed to provide information about the use of group-based MBRP as a relapse prevention strategy for military veterans who have completed an intensive SUD clinical treatment program. Introduction. Over the past several years, research has demonstrated either superior or comparative efficacy of mindfulness-based interventions, MBIs, when compared to other evidence-based interventions in reducing substance use and prevention of relapse. Several meta-analyses have shown optimal effectiveness in reducing substance use and craving when MBIs are combined with standard SUD treatment. Proposed mechanisms underlying the effectiveness of MBI in individuals with SUD include improved emotional regulation, decreased reactivity, and restructuring reward processes by increasing appreciation of natural rewards. Mindfulness-based relapse prevention, MBRP, is a manual-based therapy that integrates coping skills training from relapse prevention therapy with mindfulness-based practices, with the intent of raising awareness of triggers and reactive behavioral patterns, teaching skillful responses to triggers, increasing tolerance of challenging physical, emotional, and cognitive states, and decreasing the need to alleviate discomfort with substances. Several randomized clinical trials using MBRP conducted in community SUD treatment programs have demonstrated efficacy in reducing polysubstance use and heavy drinking. In one 3-arm randomized study, participants completing inpatient or intensive outpatient community-based treatment were assigned to an 8 weeks aftercare program of either MBRP, relapse prevention RP, or treatment as usual TAU. At the 6-month follow-up, participants assigned to MBRP and RP compared to TAU reported significantly lower risk of relapse to substance use and heavy drinking. Participants who reported use of substances reported significantly fewer days of use and less heavy drinking. At the 12-month follow-up, participants in MBRP compared to those in both RP and TAU reported significantly fewer days of substance use and significantly decreased heavy drinking. Subsequent secondary analysis found that individuals with severe SUD and high moderate anxiety and depression derived the most benefits from MBRP. Rates of SUDs are significantly higher among military personnel and veterans as compared to the general population. One study found that nearly 50% of active duty servicemen reported binge drinking in 2008, as compared to 35% in 1998, and misuse of prescription opiates increased from 2% in 2001 to 11% in 2008. These findings suggest that the need for improved treatment for SUDs in the VA setting will increase in the future. In spite of the high prevalence of SUD in veterans and the growing evidence base supporting the use of MBIs in the treatment of SUDs, MBIs have not been systematically explored in the treatment of SUDs in veterans. However, a recent study found that 18% of veterans surveyed reported using mindfulness meditation in the past year, significantly exceeding the number of veterans who had used any other complementary and integrative health approaches. Most used mindfulness meditation to treat stress, anxiety, and depression and reported good results, but were unaware of any MM-based programs within the Veterans Administration Health Center. This is important because veterans with SUD often have more impaired physical and mental functioning, including anxiety and depression, as compared to non-veterans, despite having higher treatment engagement rates. In addition, a recent investigation of mindfulness-based stress reduction, MBSR, compared to present-centered group therapy in the treatment of veterans with post-traumatic stress disorder, PTSD, found that both treatments were equally efficacious in decreasing clinician-rated PTSD symptoms, but there was a greater improvement in self-reported PTSD symptoms in the MBSR group. The risk of relapse to substance use is highest during the period immediately following treatment, and attention to continuing care is critical. In fact, the rates of relapse associated with alcohol, cocaine, heroin, and other substances of abuse are estimated to be at over 60% following any single treatment episode. Of interest, an IOM report on SUD treatments for veterans recommended that the military health system shift its focus from acute care to outpatient and chronic care for individuals with SUDs, encouraging individuals to remain connected to a recovery-based system. Thus, new continuing care strategies that target changes in lifestyle and coping mechanisms are critical to maintaining abstinence, rehabilitation, and functional improvement for veterans with SUDs. The study described in this manuscript is a 2-site randomized controlled trial designed to explore the efficacy of an 8-week MBRP compared to the 12-step facilitation TSF aftercare group on substance use outcomes in military veterans following completion of an intensive outpatient treatment IOP or residential program for SUDs. We chose to enter participants from Veterans Administration Medical Center, VAMC, affiliated IOP, and residential programs because the number of treatment hours and content of the IOP and residential programs are the same. In the IOP, individuals go home between treatment days, where in the residential participants stay in the VAMC designated sober housing for the duration of the program. TSF is an efficacious and commonly used aftercare strategy. We chose to use an active comparison treatment because we reasoned that some aftercare treatment is essential, and a comparison with TSF would allow for some control of the time and intensity of aftercare received. We chose to have 2 sites to improve study generalizability and allow completion of the study in a more timely manner. Discussion. Substance use disorders are chronic and relapsing conditions, and treatments that can help individuals maintain abstinence once they re-enter their lives after an intensive treatment period are of critical importance. In comparison to the general population, military personnel and veterans are at increased risk for developing SUDs, and the risk of relapse to substance use is highest during the period immediately following treatment, so attention to continuing care is critical.